Hello everybody, it's Ryan Liberty and welcome to my series on PTSD and trauma, everything that you need to know. This series will be an overview of everything you need to know about trauma and PTSD, and that will be so that you can increase your knowledge around this area, so that you will get a better understanding of what you or a loved one is going through, and that way you can be better equipped to help yourself or to help that loved one as you go through trauma and the effects of trauma. In this series, I'm going to cover topics such as what is trauma, which you'll be finding out here in this video, who is at risk for developing a trauma and stressor-related disorder, what the symptoms of a trauma and stressor-related disorder are, how that affects your body, what are the available treatment options, and a number of related topics to trauma and PTSD, post-traumatic stress disorder, so that you can have a nice, well-rounded overview of what it all is. What is trauma? When we're talking about trauma, we're typically talking about a traumatic stressor, and a traumatic stressor is any event or circumstances that threatens your life, threatens to injure you, or it could include threatening something like sexual violence towards you. It doesn't have to be you, it could also be towards a loved one that you know. Any of those things qualifies as a traumatic stressor, and we would call that trauma. Something I want to point out is that trauma does not have to be something that's experienced over and over and over again. It can just be one instance to be trauma. There are differences between it happening once and happening multiple times, which we'll explore throughout this series. Also, something I want to point out is that trauma doesn't have to happen to you for it to be trauma. You can be a witness of trauma and still have that be a traumatic stressor. What are some examples of trauma? Some examples of trauma include childhood abuse, including neglect, violence, including domestic violence, rape, being at war, natural disaster, sudden unexpected death of a loved one, surgery or medical illness, or witnessing any of those things could also be trauma. What are trauma and stressor-related disorders? Trauma and stressor-related disorders are what happens when we experience a traumatic stressor or multiple traumatic stressors and we find ourselves unable to cope with them. The disorder is a pattern of behaviors, a pattern of thinking, a pattern of emotions and feelings, and a pattern of body experiences that then impairs our ability to go on and live life as we normally would. That is the disorder. Now, each trauma and stressor-related disorder has a wide variety of symptoms, and we'll discuss them more here in this series. There are a number of factors that determine whether or not somebody will go ahead and have a trauma and stressor-related disorder after experiencing a traumatic event. Those factors together are called resiliency. If we want to see the chain of events that leads up to a traumatic and stressor-related disorder, we can look at them as so. First, there is a pre-traumatic factor, and that is some of those resiliency skills that will help determine. Then there will also be a traumatic stressor, and that would be when the peri-traumatic factors come into play. Then there will be the post-traumatic factors after the event has occurred. And depending on the sum of all three of those different factors, we will either cope with the trauma and continue living our lives as we normally would, or we will wind up with a trauma and stressor-related disorder. Now, sometimes the trauma and stressor-related disorder will not show up so clearly right away. There may only be a few of the symptoms presenting, and they will show up later with a delayed onset, so that's important to note. What you need to know about trauma. Trauma is any event that threatens your life, threatens to harm you or injure you, and that can include something like sexual violence. It can also be something that you're witnessing somebody else go through where their life is being threatened or they are being threatened of harm or sexual violence. It is something that can happen one time with one event, or it can happen over multiple events, and we'll talk about the difference between those two in the rest of this series. There's a number of factors that will determine after a traumatic stressor whether you go on to develop a trauma and stressor-related disorder. And those factors altogether are called resiliency. You can have two people experience the exact same traumatic stressor and have very different outcomes. One person may go on as if nothing happened and continue living their life. Another person may develop a trauma and stressor-related disorder and have a lot of difficulty in life. 71% of people in the United States have witnessed or experienced a traumatic stressor. We are all affected by trauma in some way, in that we all know somebody who's gone through this. I invite you to learn more about this topic in the rest of this series, and if you're finding this information helpful, please subscribe.